Welcome to Skin Sync, the official podcast of Elevate-Derm Alliance, your trusted source for the latest in dermatology for PAs and NPs. Join our hosts for real clinician perspectives and expert guest insights as they explore everyday dermatology topics with practical takeaways.
Hi, everyone. This is Bucci Nita, and welcome back to the Skin Sync podcast. I'm so pleased to be here today again with our co-host, Jenny Laminack. She is an Elevate colleague, a friend, and we're going to talk about why sexual health matters in dermatology. So welcome back, Jenny.
I'm excited to be here. Thank you for having me.
Thank you. So what made you choose this topic today? Let's talk about it. Why? What made you want to have this conversation?
I think it's an important conversation to have because it can be a little bit taboo, not only, in the general population, but also for our patients. Like they don't always open door and tell us about these sort of things. They consider them to be more private issues. So I think it's important that we're aware of these conditions and that we're asking the questions.
I agree 100%. I think a lot of the things that we treat in derm involve more intimate areas, right? And if we don't
Mhm.
ask the question, sometimes patients aren't comfortable telling us about it. I can count at least 3 patients today who had a concern about something in an intimate area, but they didn't bring it up initially. They actually saved it until I was about to walk out the door. And of course, I'm not going to say no. So now we have to get you in a gown and a drape and really do a proper exam. But I think they're embarrassed oftentimes to tell us about this. And so I think it's important that we are the ones that offer these conversations and we are the ones that give them that open door to share with us. So, what are some of the things that you've run into as far as conditions in dermatology that seem to have some of the greatest impact on sexual health?
I think probably the biggest one that's on the forefront of minds now, which is great because I feel like it was such an overlooked condition, even the matter of just like a year or two ago, was hidradenitis suppurativa. Um, I think it has one of the highest impacts on sexual quality of life among dermatology conditions. Just dealing with the lesions in these really sensitive areas, the groin, the vulva, the buttocks, under the breast, and dealing with more what I feel like patients feel like are really embarrassing issues. So the drainage, the odor. So yeah, absolutely. I feel like that one's the one that really comes to mind. And the exciting part is there are new treatments coming to market, but I feel like it's been such an overlooked condition.
Absolutely. And I think a lot of the times, just like you said, it's so many different aspects of HS, right? It's not just
Right.
the pain, it's the odor, it's the discharge. Oftentimes, it's the physical appearance, the scarring and pigmentation that gets to be so severe, they don't want anyone looking in that area. And, then having to explain it to a partner, especially if it's a new partner, can be highly embarrassing. And patients, oftentimes with HS, they will completely shun and avoid intimate relationships, and it can have a major impact on their overall quality of life, their loneliness, anxiety, and depression rates. So I think this is a big one. And if we're not asking these questions, I think we're doing our patients a disservice. It's really important to bring this up. I can't say that I do it consistently every single time. I think I just have this assumption that I understand that they're going through this, but I think it is important to ask that question and do our best to try to comfort them during that time.
Absolutely. And a lot of them, have been told they have other diagnoses or that they're unclean or whatever the case is, like very untrue things. So I agree. Yeah, just knowing that we can be there for them and really give them answers, I think is huge.
Absolutely. Another condition that we run into, psoriasis, right? Extremely common. We see it daily in clinic. And, we'd have patients that walk in with just, your typical plaque psoriasis on the scalp or the elbows. But this is not something I used to always do. But now I pretty consistently ask them about these intimate areas, right? Or even just the skin creases. We know that inverse psoriasis tends to favor under the axilla area, under the breast, the groin and buttock area, sometimes on the actual vulva and mons pubis. And so, again, historically, it's not something I typically asked about, but now that we know these correlations, oftentimes I will ask that question, especially if I'm not sure about the diagnosis. Sometimes it really can help you nail that diagnosis. Do you do the same?
Oh yeah, I agree. And talk about another condition that gets misdiagnosed or the patients come in and they've already been diagnosed in the past with what they can like jock itch or yeast
Yes. For
infection.
years, for
Um,
years and years, they're being
yeah.
misdiagnosed and being, mistreated.
So they think they have this chronic fungal infection. So when you're able to kind of give them, again, that information and treatment options, I think it's huge.
Absolutely. So again, I think it's important, number one, if you see psoriasis anywhere else on their body, is to ask those questions
Mhm.
and understand that this is, while it may be a low body surface area that's just involving their buttocks or genitals, it's what we consider a high impact area. So we know it has a major impact on that patient's quality of life, the pain, the itch, the discomfort, and just the overall embarrassment that can come with having disease in these locations. So again, make sure that you're asking your patients and
Absolutely.
treating. And we have wonderful options now, non-steroidal therapies that can effectively treat these
Mhm.
locations. I think that's fantastic. So, lichen sclerosis, how often do you run into this in your clinic, Jenny?
Not terribly often. I would say I see a handful a year, but also I need to be asking the question more often, off in the private area. I usually when I'm doing my full body skin checks, I have people disrobe to a comfort level, and a lot of times the women are leaving on their underwear, but I am making a better habit to really ask these questions, and also being able to treat them, or if it's become even more of like a chronic, more serious issue, we have some great referral sources here in the Atlanta area, which has
Absolutely.
been very helpful.
And I think the important things for me is, again, just opening that door, like you said, just asking when you're doing that full skin exam, is there anything in your groin, genital, or buttock area that's been bothersome or
Mhm.
noticeable? And oftentimes that will open the door for them to mention something that they did not originally complain about. And the biggest thing when it comes to lichen sclerosis is that obviously making that diagnosis, some clues would be if you see it outside extragenital lichen sclerosis, then that may be a
Mhm.
higher risk of having it in the genital area, but also helping the patients understand the risk of squamous cell carcinoma and malignant transformation. And so if they don't treat, I have a lot of women, they will have periods where they're completely asymptomatic and they start backing off their topical therapies. I'm like, no, 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 we can't do that. We
Yep.
cannot do that. So I really encouraging them to stay on top of the therapies, understanding what that risk is if they're having chronic inflammation, and making sure that we're all on the same page and getting their gynecologists involved too. Correct?
Absolutely, yeah, and just being able to identify it early and treat it, I think is huge.
Yeah, and even if it doesn't transform to squamous cell, we know that there can be long-term atrophy and damage to the
Mhm.
skin. And so if you have a local expert, we're lucky enough to have one in Atlanta that treats a lot of vulvar dermatoses, but again,
Mhm.
getting that patient to someone that can effectively treat them is really, really important. So, what other
Yeah.
conditions, Jenny, are you seeing that affect this area, these private locations?
Yes. So, and this is an unlikely one, but atopic dermatitis, I've have several patients that have like the areolas, and the
Yes.
nipple area affected, the groin area. So atopic dermatitis is not, limited to just like other areas of the body. A lot of times it happens in these areas as well. But even when it doesn't, I have one patient with pretty severe atopic dermatitis who won't sleep in the same bed as her husband, just simply because the body heat is a trigger for her. So being able to get her on a therapy that's been able to maintain her has been such like a game changer. I feel like, we have the power to change these patients' lives as long as we're asking the questions.
Right, and I think in that situation, I would never have even thought to ask that question and to get to that, to understand that the patient's doing that.
Yeah.
It's how much of an impact it's having. Yeah.
Full disclosure, she volunteered that information. I did not ask, but
Okay.
but since it happened, I have been better about kind of opening up and asking
I
patients.
think that's great. And one thing I'll bring up with atopic dermatitis, or really just any sort of dermatoses in the vulva, contact dermatitis, obviously, especially women, they oftentimes think it's yeast, right? And so they're treating it with these yeast infection agents, and that can be pretty irritating. Men automatically assume it's an STD. And so that
Yeah.
that freaks them out. And what I find that patients do is they'll go into this frenzy of cleansing. Like they are scrubbing the
Mhm.
life out of their vulva and their scrotum and penis and causing even more damage. Right now they start getting lichen simplex chronicus in these areas. And I'm like, you've got to chill. You've got to back off
Yeah,
of the
some
yes.
polypharmacy.
Yes.
Um,
They're using
Totally
strong
agree.
agents, these strong soaps. Using washcloths and getting up in there, and we've gotta tell them to kinda baby this area. Let's treat it really, really gently. And one thing I've heard is although you do wanna be cautious about overusing topical steroids, the vulva's pretty resilient, right? We push babies out of there.
Mhm.
So,
That's right.
it's pretty resilient, and sometimes you do have to resort to high potency topical steroids when you have really thickened, really itchy, really uncomfortable lichen simplex chronicus on the scrotum or in the vulva, which we do see quite a bit of.
Yeah, I think the reward far outweighs the risk.
Absolutely.
Even though those areas are really thin skin, we just need to make sure we're treating adequately.
Exactly. Another condition, I don't have a ton of this, at least in this location in the vulvar region, but lichen planus. I have a few patients now, one who has it in her vulva, another that actually gets it under the breast. I see that a lot in women too, just lichen planus under their breast. I don't quite understand why. Maybe it's the friction. Is this something you've run into, Jenny?
I'm with you, not as commonly as a lot of these other skin conditions, but absolutely it's out there. And just want to make sure that I'm doing a good job identifying it and educating the patient.
Absolutely, and it can cause pretty extraordinary pain, the burning, the itching, obviously discomfort with sexual intercourse, and then eventually patients again that chronic inflammation can lead to scarring. So it's important that we try to treat this aggressively. I have a patient now on methotrexate. We've tried every topical we can possibly think of unsuccessfully, and she's doing beautifully on methotrexate. So sometimes we got to pull those old tricks out of our bag. But again, lichen planus. So if you are seeing it in other places, sometimes on the skin, if you're seeing it on the gums or in the oral cavity, it is important to ask that question about whether they're having it in the vulva or in the genital region. Yeah.
Absolutely.
And then one more condition I wanted to bring up that people I don't think we think about it as often when it comes to sexual health and the genitalia is vitiligo. Having it on the genitals is extremely common in all ages. And imagine how distressing that is to a patient, especially if they don't know that they have vitiligo. I had a young gentleman recently who his was actually quite itchy, but he had an itchy condition on the penis and scrotum, and it was driving him insane. He was, of course, he's in his 20s, so he's distressed thinking that it's something sexually transmitted. He was in a new relationship at that time. He confessed to me that he was actually taking his mother's Xanax prescription to try to deal with the stress that this was causing him. He'd been misdiagnosed previously, and I saw him and diagnosed him with vitiligo, and he was like, "Oh, that's great." I'm like, "Huh?" And he was so pleased and so happy to know that it wasn't an infection and it wasn't an STD and it wasn't something he was gonna spread to his new girlfriend. He was actually, relieved to hear that it was something that could be treated, but again, wasn't sexually transmitted. So I think we have to remember that impact, that it's again, not just the visual, the visual aspect of the condition, but it's the mental aspect that patients are running into.
Yeah, and I think that's one of the best things we can do for these patients, besides obviously, treating their conditions, is just educating them and letting them know this is not their fault.
Yes. I think that's a big one, especially if you can kinda share that this is common in this condition, that it's completely normal to have, vitiligo in this
Mhm.
area, that it's nothing. And I think, again, getting them out of that mindset that this is something that they did that caused it or some kind of sexually transmitted disease. But I think just giving them that reassurance is really, really important. So
Absolutely.
let's get into the things that we actually do expect and commonly see in the genitalia that actually are sexually transmitted. What are some of the conditions that we're seeing pretty commonly, Jenny?
Of course, genital warts or condylomas, caused by HPV, super common. I see them often. Again, this is probably one of those things that you're on the way out the door and the patient decides to mention. But we have good treatments for it now, but you just have to educate patients, especially female patients, about getting their cervical exams, and also kind of offering up the different treatment options, whether it be destruction or topicals, and just making them aware of how it's spread, and just providing all that information.
Absolutely. And I think, again, giving the patient that reassurance that this is extremely common, that most sexually active people have been exposed to this at some point in their lives, that, it's very treatable, it can be very transient. And I think just kind of giving them that reassurance that they're not dirty. It's not something that, that they have to really stress over. Obviously, you want to take those precautions. Again, just like you said, getting the pap smears. And I even tell my male patients, like, if you have a female partner, it's important that you share with them that this could potentially cause cervical cancer. Are they always going back and telling them? Probably not, but but I'm going to share that
But you've
knowledge,
done
and
your job.
I've done my job and
Uh,
let you know. And I think the other thing too is encouraging vaccination. We know the vaccine now is approved for up to age 45, and so even if they didn't get it in their their pediatric years, they can still get the vaccine up until 45. I think it's so important to, while it is more effective at younger ages, it still can be extremely helpful in preventing certain subtypes of HPV. And it's one of, I don't know if there's many other vaccines that have done this, where there is a clear decrease in cancer, in cervical cancer associated with this vaccine. So I think it's so important to encourage patients. Again, there's a big mistrust now when it comes to vaccinations, but I think this is one of those situations where it's really important and you're potentially saving yourself or your child from having cancer in the future. I think that's huge.
Absolutely, and I find that patients are less resistant to that specific vaccine than others. Yeah, it's awesome that we have that option now.
Absolutely. And then, of course, you've got herpes simplex virus, still very, very common. The things I'll mention here is, again, having that conversation. I think the worst part of this for patients is the chronicity of it, right? There's no cure. It's unpredictable. And I think for patients explaining to them, especially when they have it in unusual areas, I wouldn't even say unusual, but the buttocks. A lot of patients will present
Yeah.
on with lesions on the buttocks and don't realize that it's genital herpes there as well. But I think breaking down the diagnosis, helping them understand how to manage those flares, and then putting them on long-term prophylactic therapy if necessary.
Absolutely, yeah, and I have a lot of patients that do opt to be on the long-term more prophylactic therapy just so they're not having to be concerned about getting a flare.
Exactly. But again, remembering how distressing this can be for patients. Again, trying to
Mhm.
normalize that diagnosis because it is very common and just trying to do the best we can, just like you said, reducing that risk of transmission. So, any tips, Jenny, when it comes to just having that conversation with patients and trying to get them to be comfortable sharing with you without making them feel like, they should be embarrassed or hiding things from you?
I think what you just said, normalize the conversation, let them know that these are common conditions. So instead of maybe saying like, are you sexually active? Maybe like because this condition affects the genital area, I like to ask my patients if symptoms are impacting their intimacy or their relationships, just to sort of kind of soften the blow a bit, not to be accusatory, just trying to make them as comfortable as possible.
Absolutely. And I think just using open-ended questions, just asking them, is this affecting your confidence or your relationships? Are you having pain? What symptoms may you be having with this? Or is there pain or discomfort with intimacy? And then are there any concerns about your sexual health? Even if it's not something I can particularly manage, it's something I can refer them to the right provider.
I think it's important to remind patients that these are common, that they're medical conditions, and then they just deserve care without feeling shame.
Absolutely. So just kind of closing things out, Jenny, again, we in dermatology, I don't know that there's a specialty where we're seeing so much of the patient's body as it is in dermatology, right? I think we're seeing full-blown naked patients every day, all the time. And so I think we're in a really unique position to be able to have these conversations, make the patient feel more comfortable, open up that door and, reassure them, give them that reassurance that they're okay, that it's whatever's going on, we can potentially treat it, and they should not be ashamed to share with us.
Absolutely. We can make a vulnerable situation a lot more comfortable as long as you saying the right things.
Absolutely. Jenny, thank you so much. This is a great topic. I'm so glad that you came up with it. I think it's so important for us to be having in clinic. And yeah, I hope you guys learned a lot from this. But thank you all for listening. Jenny, thank you so much for joining me again. And I can't wait to have you back.
Thank you, Bucci.
Okay.
Thanks for tuning in to SkinSync. Don't forget to subscribe to SkinSync on Spotify or Apple Podcasts so you never miss an episode. To explore more of Elevate's educational and career resources, visit elevate-derm.com. Please note, this podcast is for informational purposes only and not a substitute for professional medical advice. Always consult a licensed healthcare provider before making medical decisions. Clinicians must rely on their own judgment and training in all patient care situations.